Hi everybody, I'm Lily. This is Vanessa. We are microblading instructors at Texas Laser and Aesthetics Training Academy, and today we are going to show you just a basic run through of our microblading treatment.
So I just want to touch base on how your treatment room should be set up, as well as your technician and yourself, so that way we aren't cross-contaminating and making sure everything is protected. If you come over here, we have our cart. We have the secured biofilm, and this is so we do not, again, cross-contaminate. We are working with bloodborne pathogens. As well over here are disinfectant, sanitation, and have all of our devices that will be close to your client covered in wraps so that there isn't, again, any cross-contamination. Your technician will be moving this quite a bit. We come back to the cart. We have all of our implements here. We have our blades, gloves. Your technician will at all times be wearing this. And then all of our microblading devices down here.
All right, you guys, before we get into the actual treatment, I would always conduct a very thorough consultation with my client. A couple of things I need to have had done before this is probably her medical intake forms. This way I can scan her for any health issues that would be contraindicative, such as, recent Accutane use, thyroid issues, history of keloid scarring, and a multitude of other things, just to scan to make sure I'm not putting her health at risk. After I've kind of made sure that she is a safe candidate for this treatment, I would definitely take as much time as needed to make sure that she understands the level of commitment this requires. For one thing, the treatment is very intensive. It is a tattoo. It's not the most comfortable treatment that we offer here, so managing her expectations as far as discomfort, the length of the procedure can be a lot to handle too. It generally takes the instructors ourselves a good 3 hours just for an initial microblading treatment. Another thing I would touch on very in depth is the level of her post-care that she's going to have to commit to. There's basically going to be a week or two of downtime where she's not going to really be able to wear makeup on the brows. She's not going to be able to resume her normal activities such as swimming, sweating, anything having to do with excessive sun exposure. And then also just making sure that her and I are on the same page about aesthetic goals. I want to maybe see pictures of how she draws her brows on in the morning, what she likes about her brows, what she doesn't like about her brows, and just see, where I can meet her in the middle so that her and I are both proud of her brows when all is said and done. All right, guys, so for client prep, ideally I would have already had her numbed for about 30 minutes beforehand. Your client should always be wearing a headband and a hairnet, and in times like these, a mask is probably also a good idea. I will go ahead and use some distilled water and green soap just to give her brow and forehead area a good cleanse prior to antisepticizing her skin with a sterile alcohol prep pad. Once I have a nice clean canvas, I have all the makeup removed from her forehead area, probably a little bit of her eyelid and temple area. Then I will have her sit up and I will do a little template drawing so that her and I can find her ideal brow shape before we start to microblade. All right, you guys, so now that I have my client sitting up, she has a nice resting expression so I can see how she's gonna look at her normal state of being. I'm gonna go ahead and use a sanitized brow pencil to shape a template on her. Now you can see Vanessa already has some gorgeous work done, but any places I would need to fill in when I microblade later, I would wanna go ahead and establish that template now. On a fair client, you could see this template marking just a little bit better. This process, I think, seems the most simple when you are learning to microblade, but a lot of our students find that just drawing the template is probably the most tedious and exhausting aspect of the microblading, because you have to have this perfect before you even touch their skin. If you can't lay down a decent template, you're probably not going to be able to lay down some decent brows with microblading. It takes myself and my other instructors almost a good hour to hour and a half just to draw on the template. It can be very trial and error. Sometimes we have to show a client 3 different pairs of brows before they're happy with it. This generally is the longest portion of the microblading, but once I have this done, I show her a mirror. I make sure there's nothing about it that she doesn't like or approve of. I make sure that they're brows that I would be proud to wear, and then I can lay her down and put some color swatches on her so that her and I can choose a pigment together. Okay, you guys, so choosing a pigment color, particularly on a touch-up like this treatment, is a relatively easy process. Typically, we're going to use the same that we had done last time, but when doing an initial treatment, I'll always put a swatch of about 2 to 3 different pigments on my client's forehead and show them just a little mirror so that they can see which one complements their skin tone the best. How the colors differ in the shade, and also how dark they are. I think that darker colors definitely make my clients a little bit nervous, so I'll usually stay somewhat conservative on their initial appointment, and then when they come back and they see how that pigment had lightened over the healing process, usually they're ready for something a little bit darker. In this case, I'm going to try to match what she already has to this pigment. I think that by the time this heals and lightens in about 2 weeks, it's going to match what she already has just perfectly. All right, you guys, so once I have a pigment chosen, I will put it in a little ink ring. I will have a pre-prepared microblading handle with a blade already inserted. And to begin her microblading treatment, I'm going to lay down the first pass. Now, I generally work in 2 to 3 passes, and when I say passes, what I mean by that is I'm going to lay down a basic, what I call like a little skeleton, so to speak. These will be hairs placed every couple of millimeters apart, like 2 to 3, so to speak. And these hairs are going to establish the outside shape of the eyebrows, as well as a basic flow structure. You can see where her hairs naturally start to curve out in this direction. I will follow them, and I'm making sure that I start at the bottom of the brow, and I also establish the top of the brow. And this way, when I return for her second pass, her template will have already been cleaned off, but I'll have enough strokes in between each other that I can see where this brow needs to start, where it needs to end, and basically all I'll do after that is have to fill in the middle in my second and third pass. Okay, so one of my personal preferences as a microblader is to actually numb, not beforehand of microblading, but I like to do it once I already have a first pass in the skin. This way I feel like the numbing solution is able to get in the bloodstream a little bit easier and faster. I think it works a little bit better this way. So I generally will do the first pass without numbing if I think that my client can tolerate it. I will leave this numbing on no longer than 2 to 3 minutes. I feel like one of the worst mistakes you can make as a new microblader is over numbing the skin. And I say that because not only can it, cause pretty scary health risks, but anesthetized skin also kind of acts differently than skin that hasn't been anesthetized. The texture of it can become somewhat rubbery, it can swell, and it makes it a little bit more difficult to microblade into the skin. It almost feels like you're kind of trying to microblade on a napkin or something just a little bit with a little less give.
almost like rubber, if you will.
Yeah,
right?
no, exactly. So once I've removed that numbing after the first pass, I'll go ahead and lay down my second and third passes, and you guys can see once I already have a skeleton in the skin, now I'm just kind of filling in gaps, so to speak. There's not a whole lot of work, which is good. You don't really want to have to do a lot of strokes in your second and third pass because your client has already been microbladed for some time now. Their skin is very quickly gonna start feeling more and more sensitive as this treatment goes by. So though we don't want to rush in any shape or form, we do want to work as efficiently as possible. And once we have our first or second or third pass microbladed into the skin, we're gonna let the pigment saturate for about 5 to 10 minutes in between passes. This way it will really kind of deliver that pigment into the microchannels. We'll have better ink retention and the brows will look a lot more saturated in the end. All right, you guys, so once I have 3 passes in the skin and I've saturated each pass, I'll go ahead and remove any residual pigment from the brows, give them a good, nice final wash with distilled water and green soap, and I will have the client sit up one last time, assess her brows, make sure that there's no obvious gaps, make sure that the symmetry doesn't need tweaking. Basically just make sure I don't need to do any like last minute final touches. If I'm happy with the client's brows and they're happy with their brows, I will get some after pictures. I always get after pictures before I apply a post-procedural ointment like A&D or Aquaphor, because that ointment can make your pictures look just a little bit shiny and kind of distract from the client's brows. All right, you guys, so once I have had my client's brows cleaned off, I've taken her after pictures, I will go ahead and just apply a paper thin layer of Aquaphor or A&D ointment. Our personal favorite ointment at T. Lotta is actually Aquaphor. It's really important that when you are explaining post-care to your client, you let them know this is not an excessive application. You really just need the bare minimum, similar to how you would take care of a body tattoo. And then I would go ahead and go through the rest of the post-care procedure with them one more time. Even though I had said it in the consultation, I always think it's really important to reiterate it so they have a thorough understanding, as well as email them a care sheet so that there is no miscommunication whatsoever or chance that they may not take care of their brows correctly. So once I have given my client post-care, I've rescheduled them and I've said my goodbyes, I'll go ahead and clean my station. The first thing I'll usually start to clean is the top shelf because this is where all of our blood spill and things that need to be thrown away will go. First and foremost, I will take my bowl of distilled water and green soap. I will go ahead and put that where I can clean it for later. Same with my handle. Once I have those out of the way, all of these things I can just wrap up in the gauze and I can put in a biohazard bag to be disposed of. Okay, so lastly, we'll go ahead and clean off the bed sheet. If that does have a lot of blood spill, that will also go into biohazard, but usually it can just go into regular waste bins. We will go ahead and remove all the barrier film from our objects, give them a good old spray like a Cavicide or a Barbicide spray, and then a wipe down just to make sure they're super, super clean. And lastly, we can remove our gloves, our headband, and then we are done cleaning up the treatment.
Thank you so much, everyone, for tuning in here with our demo with Lily and Di. We very much appreciate it. and hope this serves purpose as a more of a educational kind of what to expect when coming in and taking the right precautions. If you have any questions about microblading, anything at all, please don't hesitate to call us and or email us at info@texaslasieracademy.com.